Hello. So today I wanted to talk a little bit about acid reducing drugs, sometimes called, or there's a certain class called proton pump inhibitors, PPIs, and they're medications like Prilosec, Prevacid, Nexium, to name a few, but they are medications that are designed to turn off stomach acid production in the gut. And it may sound like a strange thing to do a video or talk about, but I have been really fascinated by the effects of these medications, and I've shared a number of different things on my Instagram and with clients. And what we'll come to see as I kind of talk through them is that there are so many things that we don't get told about different pharmaceutical medications that may be really widely available. So, this is just a time to educate a little bit and kind of give the full story. You know how much I care about gut health, and these have a lot to do with gut health. So, these are medications, like I said, that are designed to turn off stomach acid production in the gut. And prescription proton pump inhibitors, I'll just call them PPIs from here on out. But prescription PPIs are typically given for stomach and small intestine ulcers, for severe GERD, esophageal reflux, and sometimes to protect people from getting ulcers that can develop as the result of non-steroidal anti-inflammatory use. So to help protect your stomach lining. These PPIs too, like Prilosec, Prevacid, Nexium, or some of them, there's many different names, they're also available over the counter as well to treat heartburn, typically, is why people will take them. Over-the-counter PPIs are approved by the FDA for a 14-day course of treatment. And many people take these well past the indicated and recommended timeline. So I myself took proton pump inhibitor drugs when I was dealing with reflux and heartburn, and ended up taking them probably for like a year, right, without any follow-up. And I've had clients who have been taking them for some for 10 years, some for a year. But we can see it's really interesting that the FDA only approves these drugs for a 14-day course of treatment to resolve an issue that's going on. And just to give you an idea of the magnitude of how many people take these drugs, I mean, when I was working as a nurse in a cardiac clinic, I would say, and this is just like my number, but like 80% of people, clients and patients I had, were on these proton pump inhibitor acid suppressing drugs. Americans spent $13 billion on acid stopping medications in 2006, to give you an idea of the magnitude of use. And the FDA has issued a series of reports cautioning against the prolonged use of PPIs, citing increased risk of infections, of bone fractures, nutrient deficiencies, life-threatening infections like C. diff. But they are still overprescribed and widely used really long term. So check in and see, are you using those? Does anyone in your family? It's not that they aren't indicated for certain issues, but we can see when we start to use them long term, they can have some pretty detrimental and serious downstream effects too. You can head to fda.gov and look up the drug safety and availability for PPIs, and you'll get a lot of different studies about what is known. So these drugs, antacids, right, might seem really harmless because they're available over the counter and anyone can just walk into a store and buy them. But they can have really serious downstream consequences when used long term that we really, really need to be aware of when we're thinking functionally and we're supporting the body at the roots. So the first issue is that they don't get to the root of the problem. PPIs are band-aids used to mask symptoms of heartburn, typically. Heartburn is a signal that there is a digestive impairment that's causing acidic stomach contents to leak up into the esophagus. So in order to treat the problem, you need to support overall digestion, not just mask the symptoms. When I started learning about this, my mind was blown, I remember, because when we think we have heartburn, right, it seems like, oh, we must have an excess of acid that we need to turn off, we need to get rid of. But really what it's pointing to is that somewhere along the line in our digestive tract, we have some dysfunction. So instead of food being broken down and absorbed and moving through our gut for excretion, it's actually sitting in our stomach. And our stomach is supposed to be really acidic. We need stomach acid, we're going to talk about later, to protect us against pathogens and bacteria and viruses we might get in from our food. But we want that area to be really acidic. What happens in the case of heartburn is that acidic stomach contents creates some pressure if there's food that isn't being digested or broken down, and it pushes on this valve, the lower esophageal sphincter, and that acidic stomach contents pushes up into the esophagus that has skin that can't handle that amount of acid. The stomach skin can or should be able to, but the esophagus can't. So that's how we get that feeling. So instead of just saying we need to turn off the acid, we want to think, well, why is the food not being broken down in the gut in the first place? And how can we support top to bottom digestion? So, while we may need something to mask symptoms or deal with really strong symptoms of something like ulcers or a lot of irritation in the esophagus, long term, taking PPIs, they just mask the symptoms. They don't actually get to the root. And that's the problem. And that's what I see happening a lot, is that we just use these as band-aids, but we actually don't do this further inquiry into what's going on in the gut and how we can support our digestive systems. The second piece is that there is an increased risk of infection when taking them. So stomach acid secretions act as a defense mechanism against enteric bacteria, and the increased gastric pH, which means less acid, I always get that confused in my head, less acid during PPI use allows for colonization of opportunistic microbes. That means overgrowth of microbes that might be bad, that might lead to more dysbiosis, that in some of the research by the FDA, things like C. diff or some pretty bad infections can kind of overgrow in the gut when we don't have that protective barrier of an acidic environment that we actually want in the stomach. The third piece is nutrient deficiencies. So we need stomach acid to break down and absorb our food. Chronic PPI use leads to malabsorption of key minerals in the body, namely a loss of calcium and magnesium. And a loss of these minerals has been shown to lead to bone fractures and cardiac abnormalities, among other downstream issues. I also see this in terms of not being able to absorb things like iron or B12 or different vitamins, or actually get your nutrients. And a lot of times having low stomach acid or just impaired digestion is correlated too with low iron or just nutrient deficiencies overall. And we know that nutrient deficiencies are a big driver of autoimmune issues or any health issues, because our immune system needs those nutrients and those building blocks to do what it needs to do. It's a big nutrient hog. So even if we're eating really beautiful foods, but we're not actually digesting and absorbing those foods, then it can be a really big issue downstream. And you can see how maybe you don't feel those things in the first couple weeks, couple months, but longer term, you're really going to feel the effects of lack of these nutrients and some deficiencies. So those are the three main things I wanted to share today. And if you're on a PPI for any reason, that's okay. I've taken them too. When you know more about it and you can kind of understand how they might be affecting your body, then we can take steps to see, okay, how do we actually get to the roots of what's going on here? So I would first get clear about, one, how long have you been taking it? And how long have you been recommended to take it by a practitioner? Two, why have you been taking it, or why have you been recommended to take it? Just get really clear so you understand. Three, is there a plan to address underlying issues while using this Band-Aid medication? Make sure you get really clear on that if it is something that's been prescribed to you. If it's something that you've self-prescribed, then you want to check into that too and see the underlying issue is probably heartburn. And I have a couple blog posts and different things I speak about how to actually support this piece that I'll share more about too. And four, do you have a plan to wean off? Right? We know that they're approved for a 14-day course of treatment. Is there a plan to wean off of these medications so that you're able to have stomach acid, to be able to break down your food when you eat it, to be able to absorb the nutrients from your body, to be able to support that healthy acidic environment that's going to protect us from bacteria and invaders? So those are the questions I would check in on first to see where you're at right now. And then from there, I'm going to be sharing more information about what you can do, how we can support digestion top to bottom. I have a program called Love Your Gut, and that is a wonderful resource. It's an online resource that takes you through 5 modules of how to top to bottom to support digestion. And it allows you to kind of apply that to your own life too, because you know I'm going to say it, we're all different. But there are some really key staples or things that we have to really kind of think about at the foundations to support the digestion from top to bottom. So you can head to ChristinaTidwell.com and you'll be able to learn more about Love Your Gut there. I also have a blog post about 3 ways to support stomach acid or support heartburn naturally. So that will be a really helpful place to start too. So I hope this is helpful for you. And I am really passionate about this because I care so much about informing, right? We can only make informed decisions when we have all the information. And I find a lot of times we don't always get the full story and have all of the information available to us. So if you have any questions, please let me know. You can put a comment here, or you can head to my website, ChristinaTidwell.com, and I'll have a blog post there as well too. So thank you.